wellness revolution starts now.
Hello, I'm Dr. Steve Hotze, and welcome to today's program. I'm privileged to have on as our guest Dr. Spiker Davis, who specializes in general cosmetic and restorative general procedures. He set up Cosmetic Dental Association in Houston in 1984. He's a graduate of the Texas Dental School and the Medical Center, which is one of the preeminent dental schools in the entire country. And he's also an adjunct professor there. Dr. Davis is a board member of the Cosmetic Dental Association, and he is also a fellow and has master status with this organization, which very few dentists have. So he specializes in cosmetic dentistry. But I wanted to have Dr. Spiker on because not only does he do cosmetic dentistry, but he's very much a proponent of biological dentistry. And we're going to explain what that is in just a minute. Dr. Spiker, thank you for joining us today.
My pleasure. I love it.
Well, listen, I don't know whether you're aware of it or not, but at least two of my daughters are your guests at your dental facility, and there may be more of their family.
Yeah, absolutely. And I saw Sarah this morning. I mean, like an hour ago.
Well, we've got at least three daughters that are going to you, so that you must be doing some good because we've got five daughters, and I don't know how many are your patients, but
yes, three.
Well, that's good. And they've got two more sisters and another brother and a sister. We got 25 grandkids, so we'll probably keep you in business the rest of your life.
I hope so. As old as I am, it'll probably be short.
No,
okay.
It won't. You're gonna live a long life, and I'm
120 is my goal.
Well, that's what Moses was, and it said when he died, he had vim and vigor, and he had a sparkle in his eyes. So if you go like that, that'd be the way to go, wouldn't it?
That's my story.
Great. Well, Dr. Davis, give us a brief overview of your cosmetic and restorative dental work, and then I want to talk to you about how you've adopted some more natural approaches to treating dental problems, particularly discussing the fact that you used to do root canals, don't do them anymore, and quit that decades ago, and also mercury amalgams, and you haven't used those for decades. And we want to discuss that. We want to discuss dental health and hygiene and how that affects the entire body. So tell us about your cosmetic and dental practice right now.
Yeah, so long story, but I saw a girl in dental school that had a gap in between her teeth, and she wanted to fix that. And back in those days, we're talking early 70s, the only way to fix it was either braces or to put crowns or caps on her teeth. And the dental school wouldn't let you do crowns or caps for cosmetics, only for disease. So her only choice was braces, and she wouldn't do that. So at that time was the first ever white filling that had just come out. And so it was kind of a paint-on plastic type of stuff. So I convinced my professor, let me paint this stuff on there. There's no shots, no drilling, no damage of any kinds being done. And maybe that way it'll convince her to have the braces. So I painted it on, and she started crying and jumped up and ran out. And I said, wait a minute, it's going to fall off. And she said, I don't care, I love it. And she left. And I didn't see her for like 2 or 3 years. And then she came in and it had finally fallen off. I don't think she breathed for 3 years, but it finally came off, and so she wanted me to do it again. By this time, I'm out of school. So I did it again because it's simple and non-invasive. And my wife saw it and wanted me to start doing it on her teeth. And so I think I did the first bonding in the world on people's teeth, and it was on my wife and this friend. And then I used to be a lab technician before I was a dentist, which means I make crowns or made crowns and stuff like that. So my lab technician that I had in the office started seeing me doing all this bonding stuff. And he said, why don't you let me make some of those in porcelain because it'll hold up better. So I think I did the first porcelain veneers in the country. And I did it with no grinding and no shots, just glue them on like the ladies do their fingernails. So it's like, okay, I'm in. So you get hugs and kisses for that. And it's non-invasive and it's reversible, and I'm still doing it that way today. So that's how I got started, and now I'm just staying where I am. I love it.
Well, do you do in your practice? Do you do braces at all?
I do what's called Invisalign.
Invisalign.
And Invisalign's little clear trays. Again, it's not an invasive thing. It's a tray that you wear, several trays that you wear that move your teeth. And so you don't have those old metal brackets and wires and all that stuff poking you. So it's very sophisticated and very simple, and patients love it.
So go back and tell me about veneers on teeth and how your alternative method is to put porcelain on teeth that are stained.
Yeah, so if they're stained or chipped or crowded or crooked, we can, in most cases, do them with no shots, no grinding, no drilling, no nothing. We just take a mold or an impression or a scan of your teeth, and then our master technician makes the veneers ultra thin, thinner than a contact lens, and then we can just glue them on however many teeth you want to do. And so we can make a beautiful smile without doing all the grinding that most dentists do for veneers.
That is remarkable. I'm in.
Okay.
You just got another dental patient. I want that done on my teeth because I guess drinking coffee all these years, my teeth, and I won't smile right now, but they need help. So,
well, I did them on my wife and about 40 something years ago, and they're still there. I did them on my own teeth about 35 years ago, and they're still there. So they last a really long time. And if they break or fall off or whatever,
you just repair them.
Still, you're just your natural tooth under there. It's not some peg or some ugly looking thing.
Well, that's tremendous. Now, Doctor, you had a change in your view of dentistry. You've obviously been one who is an outlier. You don't go along with the herd. You look for alternative ways to treat the problems than the standard way every other person does things. So you're a maverick in that sense, and that's what makes the world go around. It's the mavericks that invented, it's the Wright brothers that invented the airplane, and all the inventions have come about is because people decided there had to be a different and a better way to do things. And you've done that. Now tell us about dental health and the things that you used to do decades ago. I'm talking about root canals, and I'm talking about mercury amalgams, and how you decided that was not the best way to do things. Tell me why and what you do now.
Well, the number one thing for me was this funny story about the mercury amalgam fillings. And basically, they're made with tin and zinc and all kinds of weird metals, and then about 50% mercury. And of course, mercury is a toxic metal anyway.
Right.
And so in school, they kept telling us, well, they don't cause any problems and we don't see any issues. So we did them. And back then we didn't have a choice. It was either gold or silver. And then, like I told you, in the early 70s, the first ever white filling came out. And back then it was pretty cruddy, but it was way better from a material standpoint. And so not too long after that, I'm going to say it was about 78 or 79, the government came along and decided that when we are removing somebody's silver filling in their mouth, we're drilling in the mouth, and then our assistant has a little suction tip or a vacuum cleaner in there sucking up all the stuff. Back in those days, it basically went in the sewer and essentially ended up in Galveston Bay. And so the government decided, we can't do that. We're killing people or killing fish or whatever they decided. So we had to put this very expensive filter on our little suction thing to catch all that stuff. And it was a big thing. It took about 2 years to fill it up with all the junk. But they didn't tell us what to do with it when it filled up. So I called around. I ended up calling the CDA, and they said that we had to medically dispose of it. Well, most dentists, I'm not even sure physicians back then knew what medically disposed meant. But I asked them, and they said, well, you have to find a company and you're going to have to medically dispose of it. And I said, well, okay, but I don't know any of those companies. Can I just bury it in my backyard? And they said, oh, heck no, it's toxic waste. You can't put it in the ground. It'll get into the water table and all this kind of stuff. And so in my mind, I'm thinking they think it's toxic waste. I can't put it in my backyard, but I can put that in people's mouth. I see that as the next big lawsuit for every lawyer on the planet. So I decided right then, which was about 1980, that I wasn't going to do that because I didn't want to be part of that lawsuit. So I started switching to the white only fillings, which are basically an acrylic with little chunks of porcelain in there. So I haven't done a mercury amalgam filling since 1980. And so it's been interesting, but I still have that filter that I have to change so often and get it medically disposed of.
Now, do you remove people's, if they came to you and had mercury amalgams, do you remove those?
Yes, sir.
Good. Well, this is very important because we are very committed to encouraging our guests here at the Hotze Health and Wellness Center to get rid of your mercury amalgams for just the reason Dr. Spiker said. I've been told if you throw one mercury filling in a 2 or 3 acre lake, that the fish in that lake have mercury in them and you can't eat them because they're poisonous. Why in the world would we put it in our mouth? And the ADA, I am told, has part of the patent on that, and they make money on mercury amalgams. Is that correct, or am I wrong?
I think that is correct. I'm not 100% sure, but I think you're right.
I've read that and been told that, and my understanding is the ADA also came after doctors like yourself who promoted or did not promote mercury amalgams.
Yeah, in fact, there was one in Colorado that was going through extensive processes of removing the mercury amalgams. And he was promoting that you should come in and get those removed. And of course, back then they didn't have the evidence that they have now of what that would cause. So I think they actually ended up putting him in jail because he was taking those out. And so it was a crazy thing.
Well, anyway, we encourage all of our guests to get rid of your mercury amalgams because this mercury is toxic to the system and it can cause a host of problems from dementia to promoting cancer, and it also promotes inflammation in the coronary arteries, which leads to coronary artery disease. So get rid of your mercury amalgams. I got rid of mine, and my wife did. I don't know, when we found out about this, at least 30 years ago, we got rid of those. The other thing is nerve roots, root canals. Tell us about that, what your view of that is.
Yeah, well, root canals have been around for a long time, and especially the older root canals. And I'm not sure what the cutoff date is because I quit doing root canals a few years out of school, not because I thought they were toxic, but because I just didn't like doing them. They're nasty to me, so I didn't want to do them. And so I quit doing them and sending them to a specialist. But the technique has changed dramatically in the last few years. In the old days, they used to put these silver rods down inside your teeth. And then if the root canal leaked, you had all kinds of bacterial problems and the silver would corrode and all that stuff was getting into your system. So thank goodness they have changed all of that. But for me, I'm still not doing them. And I thought of a very interesting story I wanted to tell you about that mercury amalgam thing. I had a kid and his grandfather was chief of pediatrics at Texas Children's. And they were going to Europe for the summer. And the kid had to go to the doctor back then and get a bunch of shots to go to Europe. And then he also went to the dentist and had some fillings. So he had the shots on one day, and the next day had the fillings, silver fillings done. And that night, the poor kid, he's about 8 years old, was pretty much like in a coma. He couldn't get out of his room. He couldn't open his eyes. The lights were just killing him. And so his grandfather at Texas Children's ran every test. They couldn't find anything on him. And finally, they went to I'm going to call it a holistic dentist. I don't know what they called him back then. But the holistic dentist said, oh, my God, he's got mercury exposure because all the vaccinations have mercury in them.
Right.
It's a preservative. And then the dentist did the filling. So he just had an overload of mercury. So they came to me. I didn't know anything about what was going on, but I ended up taking out those mercury fillings and putting in those white ones we were talking about. And within just a few days, he at least got to where he could get out of his bedroom. He could open his eyes. The headaches were gone. So there's no question that there was a big influence of mercury in there. And I just thought that was an interesting story for you.
Dr. Weston Price was a out-of-the-box thinker, too, back in the 1930s. And he studied dental hygiene, not only in America, but traveled the entire world to see what people's teeth were like in the rest of the world and what they became like when they adopted the American diet. Can you expand on that?
Sure, that's a very interesting topic, but he did a lot of research, and people, like, he'd go over to Africa. They didn't have any cavities. They didn't have any gum disease. They didn't even have a toothbrush. And it's like, how can that be? And then he would track them, or found them if they'd moved from Africa to the United States, and they didn't have to go that far. They could go to London or England, wherever, but Western type diet. And all of a sudden, these people that were not having cavities, not having gum infections, all of a sudden they started to develop all these problems that we see in America today. And one of the interesting things that I have learned over the years, in 1950, the average American consumed about 2 pounds of sugar per year. And was considered a lot. In 2020, some of the studies that I've seen say the average American is consuming close to 200 pounds per year. And so that's a massive amount of sugar. And now they're linking sugar to diabetes, heart attacks, strokes, cancer, dementia, on and on and on.
Besides poor dental hygiene once you eat all that sugar.
Oh, yeah. And the hygiene is, in my opinion, gotten worse. I have 3 daughters, and they have grown up with basically no fillings. I think maybe they've had one in all their life. And it was because I was such a fanatic at home on beating them up on sugar. We just wouldn't let them have them. And I'm much more of a fanatic now than I ever was. So because it's linked to so many things, I was just trying to prevent decay.
So this stresses or underscores the point that you are no better than what you eat, and your health is going to be determined by the type of food you eat. When you eat plant-based diet, good wholesome meat that hasn't been injected with mRNA, which they're doing in the pigs and they're doing in the cows now, you can maintain good health and you can maintain an ideal body weight. And that will help prevent a host of medical diseases that are well known in the Western world, particularly the United States. We in the United States have the 40th from the top lifespan of all the nations, and yet we spend 95% of all the drug purchases in the world, 95% are in the United States. So we're overdrugged, and yet we have poor health. And the way you can stop that is not get yourself on all these pharmaceutical drugs, but get yourself on a good healthy eating program and have a good plan for treatment of allergies and treatment of thyroid hormones and your natural hormones, and a good vitamin and mineral program, which I know you promote in your practice, is vitamin and mineral supplementation.
Absolutely. And an interesting thing was that there was a lecture. I didn't go to it because I was too young and he was too old, but Dr. Charles Mayo, as in Mayo Clinic, has said for years that preventive dentistry, which is brushing, flossing, don't eat much sugar, that kind of thing, would add 10 years to your life. And I believe that 100%. Most of the patients that I see, and I consider the mouth the window to your health.
Say that again. That's a beautiful pearl right there. Your mouth is a window to your health. When we look in people's mouths and they're all chewed up and they come in with these hosts of diseases, I know it started right there in the mouth.
Absolutely. And so for me, when I see somebody that's got lots of decay and lots of gum infections and lots of abscessed teeth, I just know they got other problems somewhere else. And sure enough, you start checking their health history, and most of them have had a heart attack or had a stroke or had cancer or had something. So the window is open and it's sitting there glaring at you, telling you this person's got a lot of other problems. So I'm convinced that if you can clean up the mouth and get it going, it's a step in the right direction for your whole body. I mean, otherwise you're swallowing all that stuff. And it gets in your bloodstream. Every time you you chew, that mercury gets into the bloodstream. The anaerobic bacteria from root canals get in the bloodstream, and it goes right to your arteries and other parts of your body and can cause a host of health problems. So I want to just underscore again the importance of removing mercury amalgams, and you can go to Dr.
Spiker Davis here in Houston at his cosmetic, what is it called? Cosmetic Dental Associates. And he'll do that. And if you've had root canals, he can remove that. I heard lectures on root canals and heard how dangerous they were. And then I had a pain in my tooth, and I went to a dentist, and I unfortunately had it taken out, and it was still causing pain. In 6 months, I heard another lecture, and I said, that was stupid of me to do that. So I got the tooth removed, and I just built a bridge there, and I'm fine now.
Absolutely. Yeah, if you can find the source of the infection and remove it, I mean, that applies to any part of the body. And the mouth is, I see it every day.
Now, Spiker, you've been a recent guest here at the Hotze Health and Wellness Center. Tell me about your experience in coming in and why you, who have been tremendously healthy at your age, why you decided to come in and be seen here.
Yeah, well, that's a whole long subject, but I'll try and cut it short. But basically, I had this old fella, and I say old, he was 80-something as my physician. And this was 10 or 15 years ago, he was kind of holistic. He went around the world studying all the different stuff, and he was just against medicines if you could. And he tried to solve everything with diet and exercise, et cetera. So I loved him. And I basically have been a very healthy person all my life, so I didn't really have any complaints. But on the other hand, I like to be preventive, like I am with preventive dentistry. I want to prevent the problems, not wait till they occur and then try and fix them. So he was very up on that kind of stuff. So I went to him for a while, and then he retired. And I was so sad. He was like my old grandpa, and I just loved hugging him and listening to all of his stories. But he sent me... he sold his practice, and I went there once, and guess who was there? Jason Gorliss, that works at your office.
Right.
And so I liked Jason, but when he left that office, I couldn't find him anywhere. And all of a sudden, somebody told me, oh, he's at Dr. Hotze's office. And I said, Dr. Hotze? Well, is he a functional doctor? Because that's kind of what I was looking for. And they said, well, yeah, he's a functional doctor. And I said, well, I know Jason's a functional PA, so I'm in. So let's go see Jason. So I knew you, I'd met you once before, but I just thought you were only about female hormones. That was the story that I heard. And I didn't know you had all this other stuff. So I got in with Jason. And of course, we had a great visit, and he had all kinds of plans. And then I met you. And so that's kind of how that got started. And it's been so far, I mean, we're on a short fuse here. It's been a few months. But so far, I mean, I wasn't having problems before, but the ones I'm having are better. One example was my PSA, which was high. Now I've been following some of your diet recommendations, and it's dropped a lot. So yay, I love it.
That's great. How was your experience here with the staff?
Oh, it's awesome. You know what? You do a lot of like what I do. I am not at one of these clinics where you got to see 100 people a day to make a living, and you just run from one little treatment room to the next. And you're exactly the same way. I must have spent at least an hour with Jason. And my entire trip over there, I don't remember exactly, but it was 3 or 4 hours because you were gathering information, asking me questions, trying to understand what I wanted, trying all these things. And you just can't find the doctor these days that'll just talk to you and listen to you and try and work with you. It's extremely difficult.
What was your impression with the staff?
The staff was, well, I don't remember everybody's name, but from day one when I called, everybody was so friendly. When I walked in the door that day, it was like I'd come home. They said, hi, Spiker, how are you? And I obviously talked to them on the phone, and I told them, look, you can call me Spiker. Great. Okay, they called me Spiker. So everything was just comfortable and relaxing and friendly. And when I left, same kind of thing. And once I got home, I started getting emails. Hey, just wanted to check and see if you had any questions. Just wanted to make sure everything was clear. And it's been that way so far the whole time. I mean, I'm still getting emails from your staff telling me or asking me, what's going on? How's it going? Can we help with anything? And of course, so far, I don't need any help. I got it. But
well,
I'm looking forward to coming back. I've got a follow-up with Jason, and I forget when it is, but it's going to be in another month or so.
Great. Well, how can our listeners get in touch with you? What's your website?
Oh, website. Well, you just Google Spiker Davis. There's not too many of those guys around, so it'll go straight to my website, or it's cosmeticdentisthouston.com.
Right.
Or you can call my office, 713-781-2800. And you can even log on to the website and just send me an email. Ask me some questions. I'm open to all of that.
Well, that's tremendous. And I want to encourage all of you. I'm so very impressed with Dr. Davis and what he's done and the great job he's done with my kids and what he's going to do for me, making me look better. I'm looking forward to that, Spiker. Thanks so much for joining us today, and thank each one of you for joining us today on this interview with Dr. Spiker Davis.
Physician's Preference Pharmacy is a compounding pharmacy specializing in custom-made prescriptions made especially for you right here on site in our compounding lab. Compounded medications offer a unique solution because you're not one size fits all, and we believe that your medication shouldn't be either. You may require a dose to be made that is not commercially available, or you might even be allergic to an inactive ingredient in a medication, which may present a barrier to treatment for you and requires it to be made without that bothersome ingredient. Your body has unique needs, which means that you deserve a customized approach. So if your medications aren't helping you feel your absolute best, then consider speaking with your doctor about having your medications compounded today.
Information provided on this program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this program is at the listener's discretion.